The Heart and Circulation Part 1. Shortness of breath. Shortness of breath or breathlessness is dyspnea. At first, this is caused by exertion, physical activity such as climbing stairs, but in several cases, it may be present even at rest. A patient who is breathless when lying flat, for example in bed, will tend to sleep raised up on two or more pillows. The abbreviation SOBOE stands for shortness of breath on exercise or on exertion or on effort. Patients say, I get terribly short of breath climbing stairs. Doctors can ask, how many pillows do you sleep on? B. Heart rate. The normal resting heart rate 65-75 beats per minute. In athletes, it may be as low as 40 beats per minute. In extreme athletic activity, the heart rate can go as high as 200 minutes. The heart rhythm may be regular or irregular. In a regular rhythm, there may be early beats which interrupt the regular rhythm, or the rhythm may vary with respiration, or it may be completely irregular, as in fibrillation. When patients are aware of irregularity, they describe the symptom as palpitations. Cause. A 22-year-old student was admitted to hospital with a long story of health problems. She had been increasingly tired with a shortness of breath on exertion of nausea and palpitations. A mitral valve replacement had been carried out 3 years previously, and this has stabilized the symptoms of heart failure but was followed by episodes of atrial fibrillation, which had been particularly severe for the 6 months before admission. Heart failure. Heart failure occurs when the heart is unable to maintain sufficient cardiac output. The amount of blood pumped by the heart each minute for the body's needs. It may involve the left side of the heart, the right side, or both. In left heart failure, the main symptom is breathlessness. The symptoms of right heart failure include peripheral edema or swelling, beginning in the feet and ankles. This is known as pitting edema. If when a finger is pushed into the swelling, it causes a small depression or pit. Aorta, pulmonary artery, pulmonary veins, mitral valve, septum, Tycho's valve. El corazón y la circulación, parte uno. Dificultad para respirar. La sensación de falta de aire o disnea es disnea. Al principio esto es causado por el esfuerzo, por ejemplo, subir escalera. Más tarde puede ocurrir con el reposo. Un paciente que se queda sin aliento al acostarse, por ejemplo, en la cama, necesitará varias almohadas para dormir. Una dificultad repentina para respirar que despierta al paciente se llama disnea paroxística nocturna. La abreviatura SOHOE significa dificultad para respirar al esfuerzo. Los pacientes dicen, tengo mucha dificultad para respirar al subir las escaleras. Los doctores pueden preguntar, ¿con cuántas almohadas duerme? Ritmo cardíaco. El ritmo cardíaco normal en reposo es de 65 a 75 latidos por minuto. En atletas puede ser tan bajo como 40. El ritmo cardíaco se siente como un pulso en el cuello o la muñeca. Se dice que el pulso es de 70 latidos por minuto. El ritmo cardíaco puede ser regular o irregular. Un ritmo irregular, donde el corazón late irregularmente, puede deberse a latidos extra o octópicos. El ritmo también puede variar con la respiración o puede ser completamente irregular, como en la fibrilación auricular. Cuando los pacientes son conscientes de la irregularidad, describen el síntoma como palpitaciones. Un caso Una paciente de 21 años fue ingresada en el hospital con un largo historial de problemas cardíacos. Había tenido fiebre reumática cuando era niña y más tarde se le diagnosticó una estenosis mitral y una insuficiencia mitral. Había tenido una valvuloplastia mitral hacía 3 años y previamente había tenido paroxismo de fibrilación auricular. El problema más reciente fue el desarrollo de una fibrilación auricular persistente que había empeorado gravemente durante los 6 meses previos a la admisión. Insuficiencia cardíaca. La insuficiencia cardíaca ocurre cuando el corazón no puede mantener un gasto cardíaco suficiente, es decir, no puede suministrar las demandas de oxígeno del cuerpo. Puede involucrar el lado izquierdo del corazón, el lado derecho o ambos. Si el lado izquierdo falla, la congestión de la sangre que regresa a los pulmones se llama edema pulmonar. Si el lado derecho falla, el líquido se acumula en las piernas y los tobillos, eso se le llama edema con fobia, que comienza en los pies y los tobillos. Eso es cuando se hunde la piel si se presiona con un dedo y provoca una pequeña depresión o fobia. Complete the conversation based on the case history. Doctor, what seems to be the problem? Patient, I've been getting palpitations. Doctor, how long have you had them? For about 6 months. But I've had hair problems for years with tiredness and shortness of breath. In the end, I couldn't walk more than 100 meters without having to stop. I had to sleep on 3 pillows. I have mitral valve replacement 3 years ago, and that improved things for a while. Make a word combination using a word from each book. Add rest, atrial fibrillation, cardiac output, heart failure, on effort, pitting or edema, premature beats. Write the words a patient will use to describe the symptoms below. Dyspnea, shortness of breath, arrhythmia, palpitations, obtonia, breathlessness when flat, edema, swelling. Complete the case report. A 60-year-old woman attended the GP's surgery complaining of breathlessness on exercise. This had been increasing over the previous 8 months until it was producing problems at around 500 meters walking on the level. There was no history of chest pain. She had had several attacks of fast palpitation which last 23 minutes and were associated with some shortness of breath. She had noticed some swelling in her ankles by the end of the day. This disappeared overnight.